I mean, we had to be sure that they were dying before we went to the doctor and paid the money. It was too hard.
Healthcare is a top concern for Utah families. And as we figure out our healthcare plans for 2017, we'd better budget for an increase. Affordable Care Act premiums will skyrocket an average of 22%, according to a report released by the Department of Health and Human Services. Dave?
Indeed, and private insurance premiums are also going up.
Yeah, but as news specialist Keith McCord shows us, several families have figured out how to dramatically cut their costs.
I don't think 88's correct.
RENEE KEVERN has plenty to worry about.
Now you got it.
I have 5 children. I run a business.
One thing she no longer worries about:
You're all checked in? Thanks.
going to the doctor without insurance.
Such a relief. Because if something goes wrong, now I can say, we can go to the doctor. It's not going to break us.
Not only will the visit not break the family bank, RENEE and the rest of her family can visit the doctor as often as they'd like.
If I have 3 kids sick in 1 month, it doesn't put us over the edge. I just know what we're going to pay every month, and I don't have to worry about it.
The KEVERN family signed up with Utah's largest direct primary care group, Zenith Direct Care, and pay a simple, flat monthly fee that covers all of their primary care needs, including acute care, physicals, minor surgeries, x-rays, men's and women's health, pediatrics, and chronic therapy. No insurance involved.
It's just such a relief to know that all those basic things are taken care of.
But they have to visit one of Zenith's 3 clinics. The monthly membership adds up to $69.95 apiece per month for RENEE and her husband, and $9.95 for each of their kids.
Did they request that?
Rusty Curtis is also a small business owner and uses the direct care plan at Cottontree Family Practice in Provo. He offers the same benefit to his small group of employees.
I'm surprised more businesses haven't hopped on yet, because it's truly saving us money but enabling us to offer better quality care.
Yeah, is this the one you use? The access is a lot easier. They're able to come in when they want to. I can spend more time with the patients.
Dr. Danny Thompson's practice is part of the Zenith Direct Care group.
We found that with direct primary care, it's just like a weight off our shoulders.
That weight, coding and billing, accounts for up to 40% of a doctor's overhead. Under the direct care model, doctors won't have to worry about any of that.
To be honest with you, it's been probably the biggest frustration overall of everything we've had to do.
Sounds like a win for patients and doctors. So why don't more people and businesses use direct primary care plans?
I'm not going to say it works for everybody. Health insurance is still a good thing for a lot of people. But for a certain subset of the population, direct primary care works very well.
Aaron Thompson is COO of Zenith Direct Care and says with direct care, people still need to satisfy the Obamacare mandate. Rusty carries a catastrophic plan for his family.
Insurance has overreached drastically what they were originally intended for. Insurance used to be for catastrophic stuff.
And do another one.
RENEE signed her family up for a health care sharing ministry through Zenith Direct Care.
It's not an insurance, so you just share the costs of health care with the members.
Similar to a co-op, the health care sharing plan provides a legal exemption from Obamacare.
This is the actual form itself, Form 8965. It's a welcome bit of relief for a lot of folks that are staring at that premium increase saying, I can't do this.
I did the math this morning, actually, just thinking about it and trying to decide where we really stood. I couldn't even believe it. We're way less than half of what we were paying before.
While there are only a few direct primary clinics in Utah right now, Medline, the country's largest direct primary care company, plans to open here within the next 1 to 2 years. Keith McCord, KSL 5 News.
Interesting.